I'm Vince Stevens. I'm the Environmental Health Officer for Longreach Regional Council. Environmental Health Consultant. I do 1 week every month. So in the public health area, we look after the food that you eat, the water that you drink, things like mosquitoes, so vector control diseases or any insects or pests that can spread disease. But mostly it's food and water. From the environmental point of view, then it's all the air that we breathe, waste disposal, protecting the community from a public health and environment point of view. Look, the best thing about, I help people, and I love helping people. Sometimes we do things without realising that it has a negative impact on somebody else. And so when I sit down and speak with people, then I can resolve some of those things. So, really the thing that I love about my job is that I am helping others. Everybody knows now what was acceptable 20 years ago, what we did 20 years ago, may not necessarily be acceptable today. And that may be that's the same in a social environment. It's also the same in an environmental or public health environment. Behavioural change is not necessarily an easy thing, and most of us don't like change. So that's the most difficult aspect, getting that behavioural change and getting people to look at things from a different perspective. I've got about 30 years experience in local government. Tragedy and time equals humour. I can remember I was working, it was a major food poisoning outbreak as a result of oysters. And so to be able to identify where the oysters may have come from and what bacteria was causing it, we had to get stool samples. And so when you're saying to somebody over the telephone, look, I'm coming out, I want a fecal specimen, and they say, what's that? Like a stool sample. What's that? Look, I want a sample of your shit. But I did have one lady ring up and say, like 6 members in our family, this was late in the afternoon, and I said, do you have a jar or something that you could put a stool sample from each member of the family? To have a lady turn up the next morning with a plastic bag, it looked like an ant farm, the different layers, it was just, and she just dropped it on my desk and said, test that. As I said, it was a tragedy at the time, but quite humorous now, 20 years later. I've been doing this for 30 years and my mother still doesn't understand what I do. I'll say, I'm an environmental health officer, and they say, what's that? I'll say, the health inspector. And I'll say, so most people think that I'm a tree hugger, I'm an environmentalist. Other people think I just go around looking at food businesses. I suppose the big thing is that I just try to get across to everybody that, I'm there to ensure that, if you're living in this community, then someone is there to protect the air that you breathe, the food that you eat, the water that you drink or swim in. I try to explain to them that I'm there to protect their health by doing all these other things that they come in contact with.